Chair now recognizes Mr. Grimminger for 5 minutes.
Thank you, Chairman Carter, Ranking Member DeGette, and members of the subcommittee. It's an honor to speak to you today on behalf of the National Alliance of Healthcare Purchaser Coalitions. We're the voice for more than 40 regional and local purchaser coalitions, which together represent employers, private companies, public entities, labor union trust funds, and others, covering more than 45 million covered Americans. I'm here to provide the perspective of self-funded employers and purchasers on the immediate and pressing need for PBM reform. In particular, I'm here to voice our strong support for Sections 901 and 902 of Title IX of H.R. 10445, the original version of the continuing resolution released in December. Those two provisions provide for real from the initial purchase of the drug by their wholly owned GPO all the way down to the sale to the final purchaser. Over 100 million people receive their health care through self-funded employer health plans governed under ERISA. Self-funded employers directly contract with PBMs to manage their pharmacy benefit. Given that self-funded employers directly pay for the cost of their pharmacy and medical benefits and hold the risk of variation in plan spending, employers essentially hand PBMs their credit card and say, go out and spend our money wisely. Since ERISA's creation in 1974, self-insured employers and purchasers have been held to a fiduciary standard to oversee plan assets set aside by their employer on behalf of covered individuals. The Consolidated Appropriations Act of 2020 raises the bar for self-funded health plans, requiring them to pay fair prices for goods and services. Unfortunately, over the past several decades, the PBM market has become highly dysfunctional, to the detriment of employers, purchasers, and working families. I want to focus on two key market distortions: wasteful formulary placement and deeply rooted opacity. While clearly against the best interests of employers, purchasers, and patients, PBMs will often place drugs with limited clinical value and higher net costs at preferred tiers on an employer's formulary. Wasteful formulary placement occurs when a PBM is able to extract higher discounts or fees, not passed on to employers, from manufacturers seeking to expand market to the overpriced or low-value drug. Section 901 of the bill in front of you requires PBMs to disclose and provide a rationale for formulary placement and disclose when formularies are changed. Perhaps the most pernicious flaw in the PBM market is the level of opacity between PBMs and their plan sponsor clients. In general, plan sponsors are unable to determine the initial price of a drug paid by the GPO, the extent to which negotiated rebates are passed on to them, and whether there is a differential in pricing between wholly owned pharmacies and those by other entities. Section 901 provides vital information to employers to answer those key questions. Let me say this very clearly. Most self-funded employers, to this day, do not know how much money they are spending on any specific drug. Given that, how can employers act as prudent fiduciaries under ERISA? I want to give you a specific example of one of the challenges employers face. Earlier this week, I spoke to the benefits leader of a large self-funded plan with more than 200,000 covered lives. They are currently conducting an RFP on a new PBM. This benefit leader asked the applicant PBMs if they would be willing to provide claims-level rebate information. All of the big PBMs refused to do so. The legislation before you would mandate it. Before I end, I want to address some of the claims you'll hear from the big PBMs. The PBM industry will tell you that employers are happy with their vendors and don't want reforms. If that's the case, I'll ask you why 89% of the employers in the National Alliance survey of 188 large and mid-market employers said they support PBM reform. If employers are happy with their PBMs, then why are the nation's leading employer representatives, ourselves, the ERISA Industry Committee, the American Benefits Council, the HR Policy Association, and many others, on record supporting this legislation? The PBM industry will tell you that employers are able to engage in real negotiations with employers to design their contracts the way they want them. If so, then why is one of the largest, most sophisticated, most aggressive purchasers in our network unable to get answers to a simple question: how much am I paying for each drug? The PBMs will tell you they already pass on all or nearly all rebates and discounts. If so, then why are they so dogged in opposing a bill mandating they do what they already claim to do? There's a reason that big PBMs are willing to make false claims to you. They cannot stand the thought of a functional market in which empowered employers and purchasers can demand better prices. The legislation before you represents the most significant reform to the PBM industry in history. It is fundamentally rooted in establishing a more transparent, freer, fairer market. The big PBMs will do everything in their power to stop that from happening. Thank you again for holding this hearing, and I look forward to your questions.